Thank you, Keda. And thank you, everyone, for coming tonight to meet and discuss transportation and driving rehabilitation. So, as Keda said, my name is Ginger Yang, and I'm professor of pediatrics and epidemiology, and also at Ohio State University. I'm also PI at Center for Injury Research and Policy. So our center is one of CDC funded center in the nation, only 9 such centers. And our center is all focused on the injuries among children. So my topic of area of research is focused on TBI and the driving safety. So this is a perfect to hear. So I'm going to present tonight is return to drive after traumatic brain injury or TBI. So I'm going to discuss 3 topics tonight. First, I will introduce how a TBI can affect driving ability. Second, I will discuss current research as well as our research on when it is safe to return to drive after TBI. Lastly, I will briefly discuss how to facilitate a TBI survivor return driving because we have a next speaker will discuss more detail about occupational therapy, how to help facilitate driving. So I will just touch very briefly. So before I start, I want to ask, what is the first thing come to your mind when you think about driving after TBI?
And folks, you can unmute and shout out an answer. You're welcome to type one in the chat.
Speed would be one.
Speed, great. What else? So that means person might be speeding because they don't control.
Right, or detecting and interpreting things, life, I mean, as it's going on.
Very good. So they may, when they interpreting the event or environment may not be as they were not injured. So sometimes may not make right judgment because they are brain injured. What else?
Ginger, we have in the chat reaction time. So I think that kind of goes
Very
with
good.
what Perry was
Reaction
talking
time,
about.
they can slow reaction time. What else? Maybe give one more.
Okay, and then Charlotte wrote memory loss or brain fog that might complicate navigation.
Very good. All these are very good points. So I have a couple of lists here. First is we know that driving is important to person's independence that can be affect the brain injury can affect that ability because we want to keep independent so we can integration into the community. Driving also complex tasks require motor coordination, visual perception, and high order cognition. Someone mentioned that decision making and also that is not a clear mind when they make a decision. So sometimes driving is also most dangerous thing we do in our everyday life. Even we don't have injury, a brain injury, we can that is not because such short time need to make a decision. So when the brain become injured, they can affect the skill needed to drive safely. When to return to drive, that decision is need made collectively, not just by injured person, but need to be family members and the healthcare professionals. These are some common thoughts about driving, and I'm going to tell you a little bit of details. First is go over how TBI affect driving. So TBI first can lead to physical impairments which can affect driving ability. TBI survivor may suffer from hemiplegia, which cause paralysis or weakness on one side of a body. And this probably is one of the most common results of a TBI, perhaps the biggest obstacle to driving because after brain injury, because one side of the body just not function normally. And when TBI damage a primary motor cortex, it can be also causing several weaknesses in survivor's hand, arms, legs, even trunk. Other physical effect can be the sensory impacted. The people feel dizzy, headache, and they cannot function normally when they are driving. And finally, that is specificity is another common effect, can greatly restrict movement, make it difficult to driving. Fortunately, many of these challenges can be overcome with therapy and adaptive driving equipment. I will talk a little bit later, and the next week we'll also have details about these, how can help a person return to drive after TBI. Another aspect is vision impairment, because the TBI can affect the vision that is so important in driving, that someone mentioned, that blurred or double vision, problem with depth perception, or loss of a central vision or peripheral vision. So all this can affect their driving. The vision therapy and the eye exercise can often treat this issue. So the TBI survivors with a vision problem should also get cleared by a medical profession and a local driving agency before they attempt driving again after TBI, because vision plays such important role in driving. So the TBI can also, we just said, cognitive impairment, making decision to driving safely, which can make drive too dangerous for someone if they have cognitive impairment. Just someone mentioned memory loss, concentration, problem solving, multi task, because when you're driving, you need multitask. If you are cognitive ability that impaired, you cannot driving safely. Then another impairment affected by driving is post-traumatic fatigue, because fatigue is a common effect that can impair driving ability. Post-traumatic fatigue can make it difficult to stay focused on the road or making quick judgment. And sometimes the person can just cause one fell asleep at the well. So that can be very dangerous. It is important to make sure fatigue is under control before start driving after TBI. Another thing is epilepsy. According to data from CDC, about 5 to 10% of TBI patients will experience seizure after head injury. Some may even go on experience multiple seizures and develop a post-traumatic epilepsy. So if the individual can still driving if they only experience one seizure after TBI, as long as there is no other impairment, they can be cleared by doctor. But if someone experiences multiple seizure and or someone develop epilepsy, it may be difficult to get a drive license approved. So that is something could also affect the driving. And all this impairment can affect basic driving skills. and disrupt the skills that are essential for good driving, such as ability to maintain constant position in a lane, have accurate vision, maintain concentration over long period time, and memory functioning, such as the recalling directions, kind of lost the direction or fatigue, figure out the solution to the problem. And all this can be affect the driving safety, the basic skills. And study indicate even mild thinking difficulties, which may not recognized by injured person, may add to increased risk while driving, because just in that 1 second and 2 second that decision need to make sometimes is affected. So these are some based on the basics about how TBI affect driving skills. Do you have any questions before we move on to the next topic? Okay.
Diana had a good question here. So so in the list of vision impairments, she was diagnosed with post-trauma vision syndrome. So would that be something that would be recognized in this list? And I might guess that this is just sort of a generic list, but go ahead, Ginger.
Yeah, so I listed just an example, not exhausted the list, but that could be impact on the driving. But I think later on what maybe can be adjusted to the driving, maybe although the TBI survivor, as you may experience certain challenges, but you can adjust to your driving habit or routine. Maybe you just driving during the daytime, not in the evening. Maybe you're driving with low, the traffic is not busy traffic, heavy traffic time. You avoid those that can help the driving, or you use the routes that maybe take a little bit longer, but you're familiar with the road, so that can help. So I guess when we'll talk how we facilitate driving is we understand the challenging we may have, so we can do something to coping with that, to utilize the methods to help us still driving safely. Thank you for mentioning that. I think that is something, but you can, the profession, the doctors and the occupational therapy also will give some advice on how to incorporate in the practice. We just change the way we're driving.
Thanks, Ginger. And Diana, just to point out, with specific diagnoses and the things that can be unique about them, I think that this is a great question for next week, because then we're going to have the occupational therapist who's going to go through more of a personalized approach to how you would, work on driving skills or work through some accommodations. So that might be a good question for her.
Good. Yeah. So that those are very good questions, and now I'm just giving the general research. Then the therapy will talk about specific individualized, because each one are different, so they can utilize even the therapy and the exercise can be very different. That can help you return to drive, so you can decide when to drive and where to drive and remain that independence that is such important.
I could probably help do better next week if I talk to somebody then, really. It's a weird story, but my caregivers are sort of just, they don't want me driving, and I don't think they should even be judging that, and I think I'm fine.
Yeah, so that is this is why my question here is not whether you should drive or not. It is when it is the safe to drive. As the data will show you how many people actually return to drive, just when it is not whether you can, probably 90% can. We show the data, just the time when you start. But you can also start a little bit with the help with the therapy. You can also modify your car to facilitate that driving. I would never say don't drive, but that is something.
I just am even
next
talking
week.
transportation too, not just, I mean, that's what the friend said, don't buy a car, Perry. I can't afford it. You can't afford it.
Well,
I can't, I mean,
Perry, it's a tough time to buy a car right now. Anyway.
The prices are.
So Perry, for you, I think, again, next week would be a good place to kind of think through, okay, as a case study, what's going on with you, and what could driving rehab do for you, right?
Right.
And then also, if you're thinking about what else is on the table, I know that you were a CODA guy for a while, so the CODA presentation in the third week, I think, would also be
mainstream, right? I mean, I know mainstream.
Yeah. So, okay. So now I'm going just to tell you a little bit about the research on when it is safe to return to drive after TBI. We should never say you cannot, just say when is it safe, because we want you to keep the driving, but also want you to be safe. So the research show 40 to 60 of the people with moderate to severe TBI return driving after their injury. This is the data probably 10 years ago. Now with the new medicine, the technology, everything, the number will be increased. People with moderate to severe TBI, they can return driving. I will show you the data in the next study. So, but how long we should wait depending on the type of a TBI experience, and also is the most common guideline this here to use. If someone have a mild TBI or concussion, doctor usually recommend at least 24 to 48 hours before driving again. Although that recommendation is not evidence-based, but that is the doctor, the recommendation. But for most serious TBI, especially one that require hospital stay, doctor usually suggest wait to 6 to 12 months before attempt to driving again. And the data, depending on also the injury, because these are serious, but also even you are moderate to severe TBI, that level of severity can be very different, impact also very different. So someone can be shorter than 6 months, and someone probably will be longer than 12 months. So that is individual, is very different. So individualized medicine is very important. But after this waiting, it is very important we should consult with their doctor, with their occupational therapy regarding their driving fitness before return to drive. So with the exercise, with therapy, that return drive can be fast, early and faster. The doctor will looking any issue related to physical, visual, cognitive impairment, and that is decided whether it is safe and when can return. So I just want to share a couple of a study on return driving after moderate to severe TBI here. So this first study is conducted by the research who group of research in the TBI model system. OSU happened to be also one of the model system. The objective of this study is to describe who is able to return to driving after moderate to severe TBI. When this occurs, who maintains that activity and association with the outcome. So the study did the survey of 618 participants enrolled in the 8 TBI model system, along with 88 caregivers. So someone that is a caregiver, not the, so this 88 is not overlapping with that 618. So total is 706 participants, who these participants at a 1 year to 30-year post-injury. So those could be already fully returned to activity, but someone probably still in. So of this 706 respondents, 78% returned to drive, and 14% of this returned to drive and did not maintaining that activity. So that is over three quarter actually returned to driving. And of those who return to driving, 43% return within 6 months, and then 92% return within 24 months post-injury. Looking at that number, it is optimistic, right? So about almost half return 6 months, over 90% return 24 months. Of course, they also look at which factor associated with their return to drive. They find employment, race, family income, whether they have a seizure, severe to injury, those are associated with the return to drive. So if the injury is not severe, if you have enough family income, afford to do different things, therapist, that was affect the return drive. So this is the first study conducted in United States. Next study is conducted.
Ginger, can I break in real
Go
quick?
ahead.
Can you go back to your last slide for just a moment?
Okay.
So, okay, so you've got these 700 people, a vast majority are going to end up returning to driving. And again, within that group, quite a lot of them are doing so within 2 years.
Mm-hmm.
And I'm just trying to understand maybe what happens to that last 8%. Do they come back to driving, shortly after 24 months? Like, is it just because that we put a gate on 24 months, or, can it take, 5, 6, 7 years for some of these people to successfully come back to driving?
This is a very good question. For two things, these individual is returned at 1 and 30 years post-injury. So that means they are survivor. They may not return 2 years, but they return 3 years, 4 years, 5 years, maybe 10 years. We don't know that number. They did not report here because I can look more detailed about that. But also important thing needs self-selection. So those who complete the survey, this is the survey, probably more likely they are healthy. They are able to do the survey. If they are not able to do the survey, they probably also not able to drive, were not included in this sample. So this is probably more towards healthy end of a participant.
And one other question is, so your third point here, right? So you've got a lot of other factors that can affect maybe the opportunity to come back to driving, or the need to come back to driving either. Do you have, maybe I should ask first, is there data to sort of support what the story might be with some of these things, or do you have a suspicion of what might be playing a role there?
I think the need and the access resource, because this finding relate to the employment, family income, and the severe to injury is also from other studies showing, because they probably have been taking good care, have the access to occupational therapy that is not everyone can afford.
Thank you, Ginger.
Okay, does that make sense? but that is just want to give some high order summary, but to definitely make a difference. We say the disparity, how that affect TBI recovery. That is everyone have the needs, but not everyone's needs met. So unfortunate. So the next study is conducted in Canada, and this is looking the driving behavior 2 to 3 years after TBI injury. So this is the research trying to explore self-reported driving behavior. So they report how they're driving. Same time, they also use official driving records post rehabilitation to see the driving offenses among the individual with a TBI. So the sample size is the much smaller. So they have total is 162 adults. Among those, 48 participants with a mild, moderate to severe TBI whose driving license was suspended because of injury, them reinstated following the driving evaluation during the rehabilitation. So this is the group, they suspended the drive license, and after their rehabilitation evaluation, give them drive license back. Another 24 participants with a TBI who maintain their driving privilege without undergo driving evaluation. Either they have less severe TBI, that is the one, or they just never had any issue, want to do or did not use the therapy. We don't know. But anyway, those people still have their drive license. They may not drive, but they have that drive license. Another 90 non-injured control. So total is 160 people. So these participants were recruited from different rehabilitation center in Canada. So they compared these three groups, compared those non-injured control, the TBI group with license suspend and give them back the driving license, showing the result is basically when they ask their self-reported results, they report a significant lower score for driving violation error. So they report they did a good job, but they don't have any violation or driving error. But when we look at their official driving records, indicated they have a significant more demerit points for the last 2 years. Basically, that 2 years after injury, compared to other two groups. So and also compared to pre-injury level, both injured group find that they all have a more demerit point post rehabilitation. So basically, this also author conclusion is those individual did not perceive they have a risk. So when they report those, the group A, when their drive license suspended and after the rehabilitation reinstalled, they feel good about them, their self, and they just, but they, when they look in the official records indicated they does not perform as well as the other group. So basically, this individual may underestimate the risky driving behavior, even they have been deemed fit to drive. So basically that sometimes people may not perceive their risk, that risk could be due to their condition no longer the same as a pre-injury. So this is a second study about driving. I just give some example. There is a couple of more I can share. The third study here is return to driving within 5 years of a moderate to severe traumatic brain injury. This is another TBI model system, but this data is from the all 16 centers, and they follow this individual at 1 year, 2 year, and the 5 year after injury. So this data is actually retrospectively looking their data. So 5 year after injury, basically they coded each at 1 year, 2 year, and 5 year. They coded whether this person return drive, yes, no, at 1 year, return drive, yes, no, at 1 year or 2 year, return drive at 5 year, yes, no. So after 5 years, half of a sample have returned to driving. Those with less severe injury were quicker to return driving, but by 5 years, or within 5 years, those less severe, they're more likely. So, but the severity was not affected by the 5 years. Maybe at the beginning was, but by 5 years, no longer. And the function status at rehabilitation discharge, age at injury, race, and the pre-injury residence, pre-injury employment status, and education level were associated with return to driving. So this is a more full sample like everyone. So compare the first study I described, when they are participant survey, we have a high percentage of return, because those did not return, they probably did not complete survey. There is a self-selection bias, but this is almost everyone in the system. Half of them return driving within 5 years. But this study, the time probably a little bit earlier. This study also published in 2010. That is like more than 10 years ago, compared the other study published later. So as you see, within 10 years, a lot of changes with the treatment advancement, medicine advancement, technology advancement, give us the hope that after TBI, you can return to driving. That basically that will be very different now compared 10 years ago.
So Ginger, I have another very academic question. So you have one study that's kind of giving you some interesting data, but it's all self response, and so you get some weird effects when you do that kind of self response study. Here you've got people's records as we're following them very closely in the model systems, and so you see maybe something that's more realistic. I'm curious. So 10 years ago, you're a researcher, you're in this space, and you're certainly doing new work in this space. Do we ever look at what car people are driving or what kinds of cars people are driving? And I'm really curious to think.
Yeah, so, I think I probably have not. Right now, the car, just thinking about the car, even, but what the car driving may not be that important as involve the crash, because that whatever the car you use, that means you're already able to driving. But I think the probably the technology is what the adaptation of the car with the new technology, which probably not offered before, now can be offered. So it is like we have a new model right now. We have this when you're driving, you have car next to you, the light will on and whatever, they will provide assistance. But that is when you actually driving, your risk of driving. Actually, new study I reviewed, I did not put it here. They accept publication, but have not published, talking about the driving risk. Actually, they find the TBI driver actually is okay when they are driving, they're still safe. But this technology is a lot whether they able to drive or not. Because if the car not give them able to drive, may not be with. I know that a lot of a model you can use a hand to operate the car instead of use the right leg to the brake. You can use left foot to brake or whatever. So that a lot of changes can be modified.
So I'm thinking about both the accommodations to the vehicle, right? So,
Yeah.
you can certainly make it safer for you to be in that specific car.
Mm-hmm.
But I also think about, so I went from driving what was, quite a new car
Mm-hmm.
mid-pandemic. We said we didn't need two cars, and so I went to driving a much older car,
Mm-hmm.
and so it doesn't have the Bluetooth navigation. It doesn't
Mm-hmm.
have, the sensors, the backup cameras, all that kind of stuff. And I don't know if I'm actually safer or not safer, because now I just kind of drive and I pay attention while I drive and I'm not distracted by things. But
Mm-hmm.
also, there are things that I could be, easily making a mistake because I'm distracted. And in the newer cars, I would have more safety mechanisms. So we're not talking about how many people are necessarily crashing or getting hurt as they come back to
Mm-hmm.
driving. We're just talking about traffic offenses.
Yeah, I think I definitely see that is a confidence or fear of driving. If this is can assist in you make a decision, for example, when I drive in the car, if I follow too close, the car automatically slow down, right? That features I will not worry I will hit the car in front of me. So I think that will give driver more confidence
Okay.
if they cannot. I do think the technology can help, because otherwise they say, oh, if I brake too slow, may hit the car. They may say, even the physician may say, oh, you are not safe to driving because, but with these features, when you follow too close, the car will be stop, like slow down automatically, so you never will hit that car. I see in the future when the car even like no person, like you don't self-driving car will be, the TBI patient can accommodate a lot on that, because you don't need to be operate everything by the person, because technology can help.
Makes sense, Ginger. All right. Thank you.
Okay, thank you for the question. These are good questions. So there is another study I just listed here that is newly published. You can see some is as looking at driving pattern, confidence, and perception of ability following model, moderate to severe TBI. This may answer the question that Keda you have here, because they did a qualitative interview about the person they are driving, why they are driving. So there is a couple of study here about the driving behavior on the road assessment on the road instead of driving simulator to do the one. Now I want to shift to gear a little bit to talking about research on return driving after mild TBI. This is actually our study, and I just want to share with you about the study. Probably that is the study can just say how we conduct the study. Just want to share with you. This is an NIH-funded study, multi-site from OSU side, as well as University of Alabama, Birmingham, we did the study. So this study is um, the one is longitudinal. Following the TBI, we ask when they can return to driving. And the study is focused on teen drivers because we know TBI and the traffic-related injury are two major public health problems disproportionately affect teens. As we discussed early, injury to brain can impair the executive function, learning, and the memory, which can negatively impact the driving ability. Because teen drivers have not yet internalized the most basic driving tasks, they may be more vulnerable to interference by the cognitive demanding. So the clinical guidelines will in Canada and in Australia say no driving within 24 hours of TBI, of mild TBI, but these guidelines are not evidence-based and also not specific to teen drivers, because teen drivers still learning, they also more dangerous. So this is why we conduct the study. We also don't know that mild TBI affect teens driving performance post-injury. When can teens safe return to driving following a mild TBI? I mentioned that a football player went to football game, and that is high school football player injured themselves, and because he drove himself to the game, he had to drove himself back. That is not only impact himself but also others on the road. So our goal is to longitudinally evaluate driving performance of teen drivers following mild TBI as compared to matched healthy control. And we assess the driving performance on a high fidelity driving simulator. So the picture is taken at the OSU driving simulator lab. So the outside, the screen is 360, the moving, and the car actually is not moving. The simulator also donated by Honda company. So we have mild TB cases that is 16 to 24 years old with the physician confirmed mild TBI diagnosed, and we recruit them within 96 hours, have them driving weekly until their symptom resolve. We also match with the control, those have no history of a TBI, match with age, and their athletes' status and type of license they have. So we have them driving on the driving simulator, have them to deal with, make a decision on the safety critical event, and compare their performance between the group. So now I'm going just to share with you about the one scenario. As you can see, so when they are driving this car, get out in front of them, could impact on their driving reaction time. So that is how we do just one of a scenario. Oh, sorry, I should go to next slides. We expect our results will contribute to understanding how driving may affect by mild TBI, and not only acute, but also during the course of a recovery, and also provide evidence to support develop a clinical guidelines. So the doctor, when they see the patient, will say, okay, maybe that you're okay to drive, but not under certain condition. So that, or when you can drive is safe, you probably need to adjust to your driving habit, maybe avoid the heavy traffic, those kind of things. Now I want to talk the last point, how to facilitate TBI survivor return to driving. And I will just briefly introduce some point, because I know next week we will discuss about this details. For many people, driving after brain injury represent the goal of recovery. The freedom to go where they want, when they want, is a crucial aspect of independence that everyone wishes to hold on to. But it is also important to remain realistic. Driving is a dangerous activity. If a person's cognitive or physical ability are too impaired, they can jeopardize not only themselves, but the people around them on the road. So this is why best way to ensure safe return drive again is to consult with an occupational therapist who can help the TBI survivor navigate the complex driving rehabilitation process. There is some sign an individual should look to get an idea whether or not they can driving after TBI. This is if driving too fast and too slow, because the comfort level, they cannot do too slow or too fast. If the too slow, they cannot go fast enough, or they just keep fast because they are judgment impaired. No, not observing sign or signals, judging the distance inaccurate when stopping or return or turning, become slow to make a decision, becoming easy frustrated or confused, have a crash or near miss, and drafting across the lane, making into other lane, got lost easily even in the familiar area. So those are the signs maybe indicate that may not be safe to driving. So the step by step, if the TBI survive should the driving, is the first they need to discuss the ability to driving with the doctor or health professional and the family members. And they need to get a professional evaluation. It is, yes, you ask a question, but also probably some evaluation from the occupational therapy to determine driving ability. Based on those evaluation, one may be allowed to drive or need to be additional training, or the vehicle needs modified before return to drive, or will need to use other transportation option for a while before return. So that needs based on objective evaluation plus other assessment to determine when it is the safe. And also in the research, in the evaluation, I think next week we'll discuss. First is looking the cognitive ability, whether the judgment, the visual that determine the adaptability of a driving. Second is also need assessment, not just do the paperwork or assessment, but also need on the road to testing to see the operating the vehicle, because after you take a break from driving, when you resume those driving, some skill may lose, or maybe your ability cannot operate as you would be, so that training can be done and to improve that of the skill to operating the vehicle again. Also to, as I mentioned, to lessen the risk of a crash, people with TBI may modify their driving habits. You still can driving, but driving less frequent than they did before the injury, or they drove only at a certain time and drove only at a certain roads. So in that way, to ensure the safety. If the individual has a physical disability but has well preserved cognitive function, they may resume driving with adopted equipment and or other modification with the vehicle. With that, they can have hand control, gas, brake system, or they can spin novel to steering, or left foot to accelerating, or lifts to enter or exit the vehicle, because they can drive but just exit or in have difficult. So all this can be done after the evaluation with the occupational therapy. Another thing is important, the consideration is person who resume the driving must also have valid drive license, especially license suspended, they have to reinstate. In some states, they must have formal evaluation before they can driving. And also if the person have a short period time that driving too dangerous, they may consider other option to for the transportation. This can be family member to provide transportation, or the public transportation that we will discuss in the following week, not next week, the week after. So those can be in CODA that system in Columbus will be very good system to provide help, transport the people to be the way they want to be.
Ginger, with when you go to the legal stuff, I'm just curious, we've talked a little bit about some disparities in getting back to driving, having the opportunity to come back to driving. What about insurance? I mean, I can imagine that can also be a pretty big barrier.
That could be big barrier, especially the insurance may not cover, or someone cannot afford the insurance. The insurance policy can be different. Those can be, I did list it here. I'm glad you mentioned, I kind of look in the time, I make sure that I'm not exceeded the time. I want to give a couple of minutes for people ask a question. So I think that I do believe the disparity affects so much, not only at the beginning of a treatment, but also the recovery. As we had speaker today, Dr. Michael McCrory mentioned, the first that 72 hours, even the treatment decision can affect recovery. So I think when the person had moderate to severe TBI, what the treatment received could be also affect their recovery. Of course, or the medical professional will treat, but sometimes certain option can be limited because of disparity. So my last slides will be the some information here, and the slides will be, I guess, will be available for people if they want to access. These are just some information. I'm sure next week and the following week we'll provide more specific information, and the speakers are excellent. They are very experienced in rehabilitation with TBI, and the person with the TBI. So thank you so much for your attention. Now I would like to open it up for your question. We have a couple of minutes. I'm happy to stay whatever needed. Should I just stop sharing so people can ask questions? So
yeah, Ginger, you can if you want to do that, that's fine.
Okay.
So folks, I have been asking questions, right? Couldn't stop myself. So go ahead with any questions you have. You're welcome to unmute or type it into the chat and I'll read it out.
I was interested in trying different forms of transportation on my own. I had been doing it for 20 years before the injury. And I just wanted to try an e-bike, not a car. Mm-hmm. My family and caregivers, my brother and sister, my mother and brother, just veto that. Like, I'm nuts. And I thought it was a good idea. And I'm only trying to go about a half a mile, basically in residential neighborhoods. And I've been doing it for 20 years. And I think I've come around, and I can do things like GPS if I wanted, and a bunch of technology. And it's been a long time, like 10 years, really. But they don't think it's an idea that I can even handle that, much less a car. God forbid I'd say that to them. They'd be like,
I understand how you feel. I know it is like that, just feel that because driving is such important to the independence, not necessarily driving itself, just give you that comfort about your independence, your ability, also your autonomy, right? So basically you that is very important. I would just say talk to Meredith next week. She probably can, she probably can evaluate you and give you some suggestions based on
positive things I can say about the e-bikes right now too. we'll leave it at
Yes.
that. I'll let you go.
Yeah, so that is whatever you that is not, I understand, it is not just the driving, it is that you feel that
Transportation.
the ability you can do things that is more important than driving itself.
Right. And I don't need a lot. I mean,
Mhm.
just small amounts. I mean, of what I
Ginger,
want
is
to do.
this, when you're talking about the impact of driving rehab, and there's a lot of steps you got to go through, right? And you said that there's generally going to be multiple people that need to sort of agree on a
Mhm.
decision. Can it be really helpful to just have these objective assessments in making those decisions? And what might be some barriers to getting those objective assessments?
I think first, I don't know what their policy on the insurance, if they cover. It is not just objective measurement, but also they actually, in the process, they can helping you achieve certain things. Like after the assessment, to say, maybe you need to do exercise, this exercise at home, and you can come to practice on the road practice, then you
That's
can achieve that goal. Like maybe you only can driving not a highway during the daytime, only this route that you are familiar, don't go further away. I understand a lot of based on the research is it is not driving, say going because they feel that ability that give them the life satisfaction because they can drive, they
just
feel
simple things
empowered.
is all I want. I mean, I'm not even trying to get, but yes, it would be great if I did long enough.
But to the family member also concern is because they want you to be safe. So
Yes.
this is why they said don't, because we can provide you, because they worried that things can happen that don't have a control. So because the
Mother's
driving
Day
is such short
Sunday,
time.
my mother's one of them.
Yeah, so that is any other questions?
I just have, can you hear me?
Yes.
Okay, it's Diana Pollock. I just have a comment and then perhaps a question. Has anyone done what I've done, which is I actually have hired drivers because my husband died in the car accident that I lost my capabilities in. And then I had to have other options because I would have been stuck at home all the time. So has anyone else hired a driver? Because I actually posted these, in a position or in a place where I could have good responses. I found someone great. And so that's actually given me a lot of freedom over the years. I do drive locally, but I don't drive on highways.
Oh, that is great. So
Mhm.
first, sorry about your experience that in the crash, but I think that might be another option that give you where you want to go and how you go there. So
They drive
Diana,
my,
I have not come across
they drive my car.
that comment before. I think people will talk about like Uber or Lyft, sort of
Mhm.
doing the rideshare
Yeah, I use them
programs.
too.
Right.
But I think, but you're talking about something that's a little bit more formal and
Yeah,
and
I mean, I
specific.
actually had them
You got
evaluated
money,
by
I would think.
company. They're insured by my insurance company on my driver's insurance policy. So yeah, there is expense with that.
mhm.
There's a lot to unpack there. I mean, I think that that's a really interesting, for the right person, for the right situation. That seems like an interesting solution set.
Other comments from the group?
I have one question that
Go
I
ahead.
want to ask.
Yeah.
So Perry talked about the e-bike, and I'm
Mhm.
just thinking generally, right? We do see a lot of people that are moving around in cities on bicycles or on scooters, right? And so it's not just cars on the road.
Mhm.
And do we have studies on return to cycling or to be able to use these other types of transportation?
I don't think I have a much one. There will be good research because I have a friend who had a cancer and he actually impute his leg, so he cannot walk. But he bought the bike with the two wheel under,
You get a
like
trike.
3 wheel, yeah, 3 wheel, so he
Through a
can
trike,
ride,
what they call
yeah,
a
so he
trike.
can just go out like driving with the hand. So instead of, so he really enjoyed doing
You can do
that.
right. You don't even need a driver's license to do the
Yeah.
e-bike. I mean, you can be under 18 or under 16.
Yeah, so
Believe
you
it or
still
not.
can get around, but in the area that is not too far, but that give you the freedom to go.
Right.
But I think, Keda, you bring very good question. Maybe that is something can working with.
I was going to say, we always come up with research ideas.
Yeah, so
I look
the
at trikes.
Dinah's solution is have the personal driver, and maybe other people have other solution that in the also in the process that can be changed when you are recovery, and when you first period time you can change with help get around.
Well, and before we go, I just want to give Melody's comment a little space here too, because it's not, driving is not necessarily the end all be all of having independence. There are other ways around it. So I think the idea that you can accommodate or adjust, is also an opportunity or an option for you. Ginger, any closing thoughts for us? Or I know we're a little over time.
But I want to address Meredith said, in my opinion, driving does not define independence. I would agree with that, but that is just part of not all, Meredith, because even you without driving, you can still do other things, keep the independence, but the driving is just a part of. So I just the independence without driving, like Diana have the professional driver, or someone even not driving, they can still keep independent, live quality of life.
Delivery of things too. I get that right now, groceries and
or being on Zoom, right?
Yeah.
Yes.
So you
to do
don't
these
have
things.
to be travel around. I did to see some got to the new call that is Jackie.
Yeah, we were talking about just the updates in these technologies, Ginger.
Okay.
And it can be overwhelming.
Mhm.
Especially if you're switching back and forth, or if you're new to these new vehicles that are very different. But probably that's just a time thing, right? You get used to it over a period of time.
So the closing the statement is, I want to thank you for being here tonight. I also want to thank you for your courage to live as a TBI survivor. So it is not easy, but you are most brave person to deal with your injury and live the best you can. So I admire you for what you have done, and thank you for being here tonight.
All right. Well, thank you so much, Ginger. And folks, so I will just remind you, so we have our meeting next week, 6:30. We'll be talking more specifically about the driving rehab, the simulator, and all of the different occupational therapy tools to help with that. Our speaker is a pioneer in this area, so it's going to be a really good treat for us. And so if you have any questions, just let us know, and we can be sure to make sure that those get asked next time. But until then, we hope you have a really good rest of your night and a good week, and we'll see you next week. So thanks again, Ginger.
Bye.